Babesiosis and Ehrlichiosis are both tick-borne diseases caused by different organisms and have distinct clinical presentations. Here are 15 differences between babesiosis and Ehrlichiosis. 1. Causative organism, babesiosis, caused by protozoan parasites of the genus Babesia, primarily Babesia microti in the United States. Ehrlichiosis, caused by bacteria of the genus Ehrlichia, such as Ehrlichia chafensis and Ehrlichia ewingi. 2. Vector, babesiosis, transmitted primarily by the bite of infected Ixodes scapularis ticks, also known as deer ticks. Ehrlichiosis, transmitted by the bite of infected Lone Star ticks, Amblyomma americanum. 3. Geographical distribution, babesiosis, common in parts of the northeastern and upper Midwestern United States. Ehrlichiosis, predominantly found in the southeastern and south-central United States. 4. Incubation period, babesiosis, symptoms typically appear 1 to 4 weeks after infection. Ehrlichiosis, symptoms usually appear within 1 to 2 weeks after being bitten by an infected tick. 5. Target cells, babesiosis, parasites infect red blood cells, erythrocytes. Ehrlichiosis, bacteria infect white blood cells, leukocytes, specifically monocytes and granulocytes. 6. Clinical presentation, babesiosis, symptoms often include fever, chills, sweats, fatigue, and hemolytic anemia, destruction of red blood cells. Ehrlichiosis, symptoms commonly include fever, headache, malaise, muscle aches, and in severe cases, leukopenia, low white blood cell count, and thrombocytopenia, low platelet count. 7. Severity, babesiosis, can range from asymptomatic or mild to severe and life-threatening, especially in immunocompromised individuals. Ehrlichiosis, severity varies, with some cases being mild and self-limiting, while others can progress to severe illness, particularly in those with compromised immune systems. 8. Complications, babesiosis. Complications may include hemolytic anemia, renal failure, and in severe cases, disseminated intravascular coagulation. Ehrlichiosis, complications can involve multi-organ dysfunction, including acute respiratory distress syndrome, ARDS, and neurological manifestations. 9. Babesiosis. Diagnosis often involves microscopic examination of blood smears for parasites or PCR, polymerase chain reaction testing. Ehrlichiosis. Diagnosis is usually based on clinical symptoms, blood tests for leukopenia and thrombocytopenia, and serological tests like ELISA and PCR. 10. Treatment, babesiosis. Treatment typically includes antiprotozoal medications such as avaquone plus azithromycin or clindamycin plus quinine. Ehrlichiosis. Treatment involves antibiotics such as doxycycline as first-line therapy. 11. Prevalence in animals, babesiosis, can affect domestic animals such as dogs and cattle, causing similar symptoms. Ehrlichiosis also affects domestic animals, particularly dogs, which can serve as reservoirs for human infection. 12. Risk factors, babesiosis. Risk factors include outdoor activities in tick-infested areas, immunocompromised state, and lack of preventive measures like tick repellents. Ehrlichiosis. Similar risk factors apply, with specific emphasis on Lone Star tick habitats and exposure during outdoor activities. 13. Seasonal variation, babesiosis. Cases often peak in late spring to early fall, corresponding with tick activity. Ehrlichiosis. Cases typically peak in late spring and early summer. 14. Long-term effects, babesiosis. In severe cases or immunocompromised patients, long-term effects can include chronic fatigue or relapses. Ehrlichiosis. Long-term effects may involve persistent symptoms in some individuals, though less commonly reported compared to babesiosis. 15. Public health concerns. Babesiosis, considered an emerging infectious disease due to its increasing incidence and potential severity. Ehrlichiosis, also recognized as a significant public health concern, especially in endemic regions where the disease is prevalent. These differences highlight the distinct nature of babesiosis and Ehrlichiosis, despite their common mode of transmission through ticks. Understanding these variations is crucial for accurate diagnosis, treatment, and prevention strategies. Thank you. Have a nice day.